With us now from Capitol Hill, we have Republican Senator Rand Paul of Kentucky. Rand, I'm going to throw you a softball question since the president's being so mean to you. But you actually, I think, could do Republicans a service here. One of the chief complaints I've heard from Republicans and conservatives since this entire health care debate has begun is when we flash up headlines where the CBO says 32 million people will lose their health care coverage if there's just a repeal. Can you explain why that description concerns conservatives who don't believe that's actually an accurate description? It's more choice than just dumping 32 million people off the rolls.
Trying to predict the future is a very uncertain sort of guessing game. And I think in the past, the CBO tried to guess how many people would get health insurance through Obamacare, and they were wildly off, to the tune of millions off. Now they've said 32, 23, various permutations of millions of people will lose it. But interestingly, one of the big premises of why people lose it is they say, if you no longer have the individual mandate, if you don't have to pay a tax to buy your insurance, if you're not sort of bullied by government, that 15 million people wouldn't buy insurance for that one fact. Maybe. It's complete guesswork. And so the thing is that I think we can put too much stock in guesswork. And to me, it's a modeling and future predictions. It's like astrology. A lot of guesswork goes involved into it.
Senator, it's Nick Confessori here in New York. Just a question for you, just to pull back a little bit. I wonder if you think that the Republican Party has made a grave error in getting into the business of promising to expand coverage. This was not always part of the conservative Bible. What we see here is an effort by the party to build a health care plan that will keep that promise, but do it through conservative means. Is it the job of the government to help ensure that coverage is expanded in the first place?
Well, see, I think overpromising is a big problem, and promising stuff we didn't really promise during the election. We promised to repeal and get the federal government out of it. Doesn't mean there's not a role for government. We thought nationalizing it in Washington was too distant from the people and destined not to work. But I think overpromising is another problem, and I've had this conversation with the president and with others in the White House, is that if you claim you're going to fix health care, I think you've got a mistaken notion. Health care was broken before Obamacare. I think it got worse under Obamacare, and next year it will be bad. The main thing is the fundamental flaw of Obamacare is going to remain. The fundamental flaw is you have mandates on insurance that chase young, healthy people out of the market because it makes insurance expensive, and then you tell them, hey, but if you get sick, you can buy it after you're sick. So this adverse selection continues. The only difference between the Republican and the Democrat plan is the Democrat plan tried to get people to buy insurance through a mandate, government force. The Republican plan is going to dump the money in on the tail end to subsidize insurance companies. I object to both. And in some ways, it's actually more morally reprehensible for the government or the taxpayer to be asked to subsidize insurance companies that doubled their profit under Obamacare and now make $15 billion a year. I just think it's a terrible and a very un-Republican idea to give a major corporation taxpayer money.
Senator, sort of a threshold question here. Do you favor the government providing an avenue to every American to have affordable and accessible health care?
I accept the goal that everybody should get health care and it should be at a less expensive cost. I don't think the government does a very good job at distributing anything. Look at, the Soviet Union distributing bread. When the government gets in charge, look at the current post office trying to deliver letters. The government's just not very good at things. But do I want everybody to have insurance at a low cost? Yes. The main problem we have in our health insurance market is in the individual market. If you work for Toyota, you work for General Motors or Ford, you're pretty well protected. If your spouse gets sick, you don't lose your insurance, you don't lose your job, your rates don't go up. I want everybody in America to have group insurance. So everybody in that individual market, I would let them join an association. And my hope is that the vast majority, if not all, of the people flee the individual market and you no longer have it. Everybody in the individual market, you should be able to join the Restaurant Association, the Retailers Association, the Chamber, the NFIB. All kinds of associations could be buyers and purchasers of insurance, and we would defeat the problem of adverse selection by getting people the hell out of the individual market.
All right, Senator Rand Paul, we thank you for coming on. Greatly appreciate it. Mike, thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.